There are four main muscles that make up the abdominal wall. And so the first one, the external obliques, are found on the superficial most portion of the abdominal wall. And their muscle orientation is going to be inferior and medial. And so the external oblique is going to be muscular along the lateral abdominal wall, and then it's going to form with the aponeuroses that is going to be projected anteriorly. So the external obliques work together with the opposite side of the internal obliques, and that helps to rotate the vertebral column. All right, so immediately deep to the external obliques are going to be the internal obliques. And so here I'm highlighting those again were the external obliques, and so if you remove that layer, then we have our internal oblique muscles. And so these muscle fibers are going to be now superior and medial in terms of their orientation. And just like with the external obliques, they are going to form an aponeuroses that projects anteriorly. So if I erase this, you can see a little bit of that forming right here in the yellow as I'm highlighting. And so again, the internal obliques work with the opposite side of the external obliques in terms of rotation of the vertebral column. The deepest muscle found in the abdominal wall is the Transversus Abdominis, and these muscle fibers run in a transverse orientation across the abdomen. And so it's the easiest way to determine this muscle. So the action for this is to help compress the abdominal content, so such as our internal organs, and also helps to aid in forced expiration, so has a role with breathing. And the last muscle of the rectus abdominis makes up the muscles of the abdominal wall. And so the rectus abdominis is found here. And this now is going to be where we have a long and strap-like muscle that's going to extend now vertically. Okay. And this will be the entire length of the anterior and medial abdominal wall between the sternum here, and then with the pubic symphysis. So runs that entire abdominal pelvic cavity and then a little bit within the thoracic cavity as well. So this muscle is separated by different segments of fibrous tissue here. And so when it's well toned, this is what gives individuals that toned six-pack